the opportunity to do so. But for those that may not fall within those eligibility requirements and should have gone to the marketplace during that time, will then be kind of caught up with the penalties and consequences.
And of course, the proposed date for the 2015 open enrollment would start November 15th, 2014. That would then end on January 15th, 2015. Now, these dates are proposed, so you have to pay attention to the news throughout the year. I'm sure there's a chance if the dates are changed, you'll hear about it. But sometimes these dates do change. This is a new program, this is a new law, so obviously there's a lot being worked out still. It's a big, big undertaking.
Correct. Definitely encourage individuals to kind of check out the news and see what's going on from your state officials to see what's going on during the summer season and early fall. And
of course, to qualify for the Affordable Care Act, you have to live within the United States and be a U.S. citizen. Now I'm going to go ahead and take another call here from the community. Hello, caller. What's your question?
Thank you for taking my question. I have a problem with my knee, and I'm curious, if I sign up for healthcare today, how long before I can actually go see a doctor and get it covered?
Great question. Well, if you happen to go to the marketplace or whatever best suits your eligibility requirements to get a new plan today, they will give you certain information and documentation that is essential to you in case you do have an emergency service or some type of reason that encourages you to go see a doctor immediately. So you will have information on hand, but just expect more official documentation such as an insurance card to come in the mail at a later date.
Okay. Now, you might also hear about people who start getting health insurance on February 1st.
Correct.
So yeah, you'll hear about people that are already starting to get their health insurance, but those dates basically have expired for when you could sign up to be eligible for February 1st.
Correct.
So yeah, you might, another date out there, you might hear about this starting in February, but if you got to sign up to get everything applied to you.
The best date to keep in mind is March 31st is when the open enrollment phase will come to a temporary hold for this early year.
And let's talk about the penalty taxes here. What's the cost if we don't sign up by March 31st?
Important penalty costs to keep in mind. They can garnish your wages from your taxes, from your income, up to 1%. Or, depending on what's higher, it can be about $95 for an adult or about $50 if there are any children in the household that were dependent on coverage plans as well.
It almost sounds like landing on the bad square in Monopoly or something.
Exactly. So be very mindful that whichever is higher could cost you a lot more in terms of penalties as well as if you do need any medical treatment or care.
Okay. Now let's talk about how you sign up and where we go on the web to find out information here.
Okay.
Now, you got the healthcare.gov website, which is the national website.
Correct.
What do people in Illinois want to be looking for?
Well, Illinois, we went ahead and kind of launched our own version of what's going on as far as the marketplace. So you might have seen a lot of media attention, but we have what is called Get Covered Illinois. It is the official health insurance marketplace for specifically residents of Illinois.
And I'm going to go ahead and put that website live on TV here for everybody. This is exactly what it looks like right now. So we're going to go ahead and just navigate a little bit just to show you exactly where you can find some things out. So
and this website is very user-friendly, offered in multiple languages, so it's very accessible and easy to kind of navigate.
So we have a drop-down menu right here, how to get covered. And you have explore coverage options.
Yes.
Okay, I'm going to go ahead and click on that, and let's go ahead and see. Now this is the beginning of a little sign up, a little get started figuring out exactly what it is that you'd need.
Correct.
So tell us about, like, what is this trying to do here for people?
So when you get to this part of Get Covered Illinois' website, what it does is simply asking you simple preliminary questions, just the basics. It wants to know who are you, but without giving your exact name or any identification. And then how do you kind of qualify or fall within certain categories? What it's essentially doing is finding out which is the best way to direct you as far as your health care coverage options. From Get Covered Illinois, you can get routed towards the official marketplace, or you can now see if you're eligible for the Medicaid programs that best suit you and your needs.
Okay. So an example, the first question would be, are you signing up for yourself, myself, and someone else who lives with me, someone else who does not live with me, or my small business or nonprofit?
Yes.
Can you talk a little bit about exactly when you sign up for a small business or nonprofit, is that something that's already going into effect for 2014?
So this particular option is for those small business owners that may have about 50 full-time employees and are looking to see what are some great options that I can offer to my employees as far as for health care coverage as well, because the law does require for small businesses with at least 50 full-time employees to offer them coverage as well. We have a little bit more time as far as deadlines for those small business owners, but it's giving them the opportunity to start checking out and see what's going on from the insurance companies to make a great decision for their business members.
Perfect. Thank you. So that's pretty much how you start to do the research, and it'll help you kind of figure out what direction to go. Another thing that you can go over to is in this drop-down menu here, we have the Get Answers.
Yes.
And then the FAQ, or Frequently Asked Questions section. I'm going to go ahead and click on this. Now, talk a little bit about why this is so useful.
I definitely enjoy this particular portion or a component of the Get Covered Illinois website. It's offering a lot of realistic, real scenario questions and answers for consumers and community members to see, okay, just in case I want to, make sure I'm going towards the right direction or accessing my options best, what do I do, or what have been some other scenarios that have come up? So with this particular component of the FAQs and different resources, you can kind of go through and see what folks have already gone through, so you're making that correct decisions as well.
So yeah, just a few that pop out here is how do I get insurance? Where will my health coverage come from? What if I have Medicare? If I already have insurance through my job. Now, that should be a pretty easy one. If you have insurance through your job, you may not need to sign up for this.
Correct.
You have the option to, as far as I know, but you might not need to.
Correct. Even so, if you may already have coverage from a family member, a partner, spouse, or a parent, or through your employer, even if you still want to just go and make sure that you understand what is going on with the Affordable Care Act law, I encourage you to check out some of those frequently asked questions, as well as the glossary terms that are offered on the website as well.
Yeah, let me show that as well. So yeah, don't take our word for it. Go to the website and find all the questions here as well. Now I'm going to go back to Get Answers, and right at the bottom here, this is very nice. Oh, let's see. Right at the bottom here, you have glossary. And that is where you can have some terms that might be a little confusing. Like for instance, we were talking before about disability coverage, or let's say that there's any kind of, I'll click on a general one here, benefits, just to kind of define for you exactly what does it mean. So you'll be hearing all these terms thrown around,
right.
Like anything specified like this, you're going to have special terms that mean anything.
Exactly.
So this is a pretty easy way to find that. So do you reference the glossary section?
Definitely, all the time. I even make copies if necessary for a lot of the community members. I think it's great to have certain documents and questions prepared, especially when going to see a healthcare provider or speaking with a representative from your insurance company.
Okay. And let me go back to some of our other... Now, one thing I wanted to focus on, now let me just remind everybody, this website is Get Covered Illinois, okay? And I want to go ahead and remind you that this is the website that we suggest that you go to in Chicago to sign up, getcoveredillinois.gov. Now, we also have a phone number for people in Illinois. Can you talk a little bit about what kind of help you can get through calling the phone number on the screen there?
Yes, definitely. So with this 866 number, and the actual entire number is 866-311-1119, very easy to remember, you're able to speak with an operator to kind of get some one-on-one assistance. What they will do is kind of route you towards a nearby location, such as a health institution or a public facility, to speak one-on-one with a navigator. These navigators are on hand, and they have been certified and trained on a state and federal level to assist individuals more detailed with their confidential information, so that they as well as making these informed decisions for their health care coverage.
Okay. Now, this number you can also call if you want to have a person sit down and talk to you about this.
Yes, those are the navigators that I mentioned.
The navigators, right. So how many, we might not even know the number here, but I'd have to say that there could potentially be 100 organizations within Chicago that provide navigator help.
Yes.
How important is it that, there's that much coverage across Chicago for people to help everyone understand this?
The great thing about the coverage being for so many individuals, for so many organizations, is that these navigators are housed in places that are very familiar to our community members. So your departments of public health, your public libraries, even a few of your community-based faith organizations may have some navigators on hand. That way it's creating more of a realistic one-on-one experience to help assist you with your health care plans, coverage, with the marketplace, with the website, or even accessing some of your opportunities now in Medicaid.
Great. Well, Melissa, I want to thank you very much for coming in today. I'm going to put your information up here real quick so people can call you at your office for more questions at 312-491-8161. extension 37. What's the last thought that you want everybody to take from today's show?
Most importantly, the last thing I want everyone to remember is that healthcare insurance and healthcare coverage is essentially very important for you, for your loved ones. What it is trying to create is a habit of healthy lifestyle so that, unfortunately, if anything does come up, then you have the necessary tools and documentation to best suit your needs and prepare you for the next steps.
Perfect. Thank you so much.
No problem. Thank you.
And thank you, everybody, for tuning in today. This has been a special show provided by CAN TV Chicago, Understanding Healthcare. We'll be back next Wednesday night with another show starting at 5 o'clock. So be sure to tune in for a whole nother look at this. And feel free to remember to call or go to getcoveredillinois.gov to find out information about signing up. And thank you again, Melissa.
Thank you so much for having me here.
All right. Have a good night.